Hysterectomy. When is a diagnostic hysteroscopy indicated? There are different clinical conditions as abnormal uterine bleeding. AUB. AUB is the most common indication in women over 45 years old. Based on suspicious images, especially by transvaginal ultrasound (TVUS), but also by CT or MRI, the endometrial pathology can be divided to focal, polyps and myoma, or diffuse, hyperplasia with or without cytological atypia, and adenocarcinoma. Any image of suspected endometrial cavity occupation by focal or diffused pathology is an indication for performing a diagnostic hysteroscopy. When diffuse endometrial pathology is suspected, thickened endometrium image, the first choice is to obtain tissue sample by using a PIP-L. It has a low false positive rate, but the false negative rate can be over 20%. For this reason, a diagnostic hysteroscopy is indicated after a negative result. The similarity in morphological appearance of endometrial atypia hyperplasia, EAH, and well-differentiated endometrial carcinoma represents a major challenge to histopathologists. When a diagnosis of atypical hyperplasia is made, there is a risk of concomitant invasive carcinoma in the uterus. This discrepancy between endometrial specimens and hysterectomy specimens on histopathological examination has been found in several reports, with 7 to 50% of women with endometrial hyperplasia with cytological atypia reported to have concomitant carcinoma in subsequent hysterectomy specimens. On biopsy specimens, the distinction between well-differentiated carcinomas and atypical hyperplasias, on the basis of distortion of glans architecture and cytologic atypia, is neither simple nor reproducible. Even by experienced pathologists it is possible to see the great difficulty to differentiate between hyperplasia and adenocarcinoma. We define the pathology that will end in a hysterectomy as high-risk endometrial pathology. This group includes adenocarcinoma on a polyp, AP, endometrial adenocarcinoma, EA, endometrial atypical hyperplasia, EAH, except in EA where the hysteroscopy has a great grade of accuracy with histopathology, both in AP and EHA. Many times hysteroscopic images are now so easy to interpret. The hysteroscopic appearance of an endometrial carcinoma is quite typical, and this visual diagnosis is generally based on the presence of a gross distortion of endometrial cavity because of focal or extensive nodular, polypoid, papillary or mixed patterns of neoplastic growth, focal necrosis, friable consistency, and atypical vessels are other features almost invariably associated with endometrial cancer and easily detected by hysteroscopic inspection. High-risk polyps are presented in postmenopausal women as an image of more than 10 mm and symptomatic bleeding or spotting. It is important to perform a complete hysteroscopic dissection of the polyp and know to leave any tissue, including the pedicle. Sometimes adenocarcinoma can be found in the polyp space. Narrowband imaging, NBI, and hysteroscopy. An element that helps in the diagnosis of endometrial high-risk pathology when applied during hysteroscopy is the narrowband imaging, NBI. This technology is a real-time, on-demand endoscopic imaging technique designed to enhance visualization of the vascular network and surface texture of the mucosa in an effort to improve tissue characterization, differentiation, and diagnosis. Enhancement of particular mucosal features with NBI is achieved by observation of light transmission at selected wavelengths or colors, because the interaction of particular tissue structures with light is wavelength dependent. Selective light transmittance is accomplished by optical filtering of white light, WL, in NBI. The use of a band of light of 415 nanometers, blue light, correspond to the peak light absorption of hemoglobin, and this enables NBI to make the Organization of blood vessels on the surface of the analyzed structures clearer and sharper with respect to observation. With WL narrowband blue light displays superficial capillary networks, offering an extremely high contrast image of the tissue surface. NBI has a very good correlation with histology, especially hysterectomy. When is a diagnostic hysteroscopy indicated? There are different clinical conditions as abnormal uterine bleeding. AUB. AUB is the most common indication in women over 45 years old. Based on suspicious images, especially by transvaginal ultrasound, TVUS, but also by CT or MRI, the endometrial pathology can be divided to focal, polyps and myoma, or diffuse, hyperplasia with or without cytological atypia and adenocarcinoma. Any image of suspected endometrial cavity occupation by focal or diffused pathology is an indication for performing a diagnostic hysteroscopy. When diffuse endometrial pathology is suspected, thickened endometrium image, the first choice is to obtain tissue sample by using a PIP-L. It has a low false positive rate, but the false negative rate can be over 20% for this reason. A diagnostic hysteroscopy is indicated after a negative result. The similarity in morphological appearance of endometrial atypia hyperplasia, EAH, and well-differentiated endometrial carcinoma represents a major challenge to histopathologists. When a diagnosis of atypical hyperplasia is made, there is a risk of concomitant invasive carcinoma in the uterus. This discrepancy between endometrial specimens and hysterectomy specimens on histopathological examination has been found in several reports, with 7 to 50% of women with endometrial hyperplasia with cytological atypia reported to have concomitant carcinoma in subsequent hysterectomy specimens. On biopsy specimens, the distinction between well-differentiated carcinomas and atypical hyperplasias, on the basis of distortion of glans architecture and cytologic atypia, is neither simple nor reproducible even by experienced pathologists. It is possible to see the great difficulty to differentiate between hyperplasia and adenocarcinoma. We define the pathology that will end in a hysterectomy as high-risk endometrial pathology. This group includes adenocarcinoma on a polyp, AP, endometrial adenocarcinoma, EA, endometrial atypical hyperplasia, EAH, except in EA where the hysteroscopy has a great grade of accuracy with histopathology, both in AP and EHA. Many times hysteroscopic images are now so easy to interpret. The hysteroscopic appearance of an endometrial carcinoma is quite typical, and this visual diagnosis is generally based on the presence of a gross distortion of endometrial cavity, because of focal or extensive nodular, polypoid, papillary or mixed patterns of neoplastic growth, focal necrosis, friable consistency, and atypical vessels are other features almost invariably associated with endometrial cancer and easily detected by hysteroscopic inspection. High-risk polyps are presented in postmenopausal women as an image of more than 10 mm and symptomatic bleeding or spotting. It is important to perform a complete hysteroscopic dissection of the polyp and know to leave any tissue, including the pedicle. Sometimes adenocarcinoma can be found in the polyp space. Narrowband imaging, NBI, and hysteroscopy. An element that helps in the diagnosis of endometrial high-risk pathology when applied during hysteroscopy is the narrowband imaging, NBI. This technology is a real-time, on-demand endoscopic imaging technique designed to enhance visualization of the vascular network and surface texture of the mucosa in an effort to improve tissue characterization, differentiation, and diagnosis. Enhancement of particular mucosal features with NBI is achieved by observation of light transmission at selected wavelengths or colors, because the interaction of particular Tissue structures with light is wavelength dependent. Selective light transmittance is accomplished by optical filtering of white light, WL, in NBI. The use of a band of light of 415 nanometers, blue light, correspond to the peak light absorption of hemoglobin, and this enables NBI to make the organization of blood vessels on the surface of the analyzed structures clearer and sharper with respect to observation. With WL, narrowband blue light displays superficial capillary networks, offering an extremely high contrast image of the tissue surface. NBI has a very good correlation with histology, especially